All right, welcome to the Mint Condition Podcast. Today we're going to give you an update on how things have changed, where things are going. There's been a lot going on, so we just wanted to share some of the things we're learning and some of the things we're trying to change. What's been really fun building a physical therapy practice has been learning all the different aspects that you have to consider. It's not just providing the right kind of care, but creating the right environment. We're opening better clinics with better space, or creating a more comfortable experience for patients. If they can get equal or similar treatment or care somewhere, but they get more thorough of an experience or more of a family experience, where you would want to send your own family, that makes a big difference. So we're trying to work with and train a lot of our staff on how to talk on the phone or just how to engage with patients, the different details that you have to consider when you're taking care of people. If you're going to be in the healthcare field, you have to remember at the end of the day, it's people that you're taking care of. This isn't just numbers or whatever else. Let's see, there's a lot of details to dive into. So we're opening up a new Murray clinic. It's going to be a lot bigger, a lot nicer. There's been a lot of lessons to learn with that. The timing when it comes to construction, the strain that puts on patients to find somewhere new and get used to somewhere new. And then also on the physical therapist and the receptionist to learn a new location. I think everybody's really excited about the new clinic, but it still is extra work. And Christian is the clinic director, and he's been here late nights and came on the weekend all day. He was helping set things up, put up TVs on the wall. So we are learning a lot of the different aspects of that. Let's pull up a couple questions to go through. So some of the updates on Mint, where we're at, where we're going. We do a lot of corporate health and wellness, so we help with injury prevention or making people's jobs better, whether it's people sitting at a desk or it's someone working on a rocket or building concrete blocks. We do the injury prevention for a lot of those, and Ryan is one of our physical therapists and heads that up. He's out there making connections with more businesses, and we've made connections with 4 new businesses that we're going to start working with right now. Other things that have changed, we had 3 new members join our team in January, some physical therapists and physical therapist assistant. And then we also have a new executive leader with us, Dave Jacobson. He's fantastic, really cares about people and building the right connections. So he's going to be an amazing team member to help us create better systems in our company so that people want to work here, and then also so that it creates better quality care for our patients. The next one, what's been the biggest growth or change that we've seen recently? I think being able to move into a bigger space like this. Mint, when we started, we were mobile and we didn't have any clinics. It was really cool to meet patients or meet people where they were at, treat them at work or in their home. There were people that I was able to help them learn better sleeping postures or set up their desk more ergonomically at work, which is really neat, but also hard for some people. Some people don't want you in their home, which is understandable, or some people just want to have a space to go to get away from their other responsibilities. So we started opening up clinics, and we rented a clinic way back. This is like 3 years ago. Rented 2 rooms from a chiropractor, Hometown Chiropractic in Murray. Fantastic group, love working with them. But now we've got our own clinic, 2,400 square feet, lots of like sporting equipment, treadmills. We've got what we need to provide a wide variety. So that's some of the growth and change that we've had. I'm most excited about having just better jobs. I think that it's really cool that we treat patients one-on-one, and our physical therapists are not burned out because they're only doing 7 or 8 treatments per day, whereas working at certain other companies, sometimes they're doing 16 or 20 in a day. And so that's fantastic. We love that setup. However, without the structure, it's made some different types of strain on their job. So we're creating more structure and better metrics and better communication and systems to make that easier for everybody here at Mint to enjoy their jobs better and feel more fulfilled. The problems that we're trying to solve for patients right now, that's a deep one. The biggest one is for our concussion patients. We're trying to solve early intervention. People who get concussions usually end up with at an ER or an MD that might not be trained or specialized in that, and it takes weeks sometimes for them to start getting the right assessments and treatment. So if you've had a concussion, you need to get to the right place. Get to physical therapists or chiropractors or neurologists who are trained on concussion, not just have heard about it or it was briefly covered, but actually went and got further training on this. So that's the main area we're trying to reach patients faster. We're getting some information out to high schools so that the high schools can do pre-concussion or pre-injury testing so that we know the baseline, what's normal for that athlete. Then when or if they get a concussion, we have something to compare it to. And then we can do our post-concussion testing and compare that to the pre-concussion ones. And same thing goes for auto accident stuff. We're not going to do pre-testing necessarily for everybody who's in a car crash, but we need to get involved sooner. If you're in a car crash, don't wait 3 weeks to start working on your concussion. That should be your second most important thing to address. First would be broken bones and bleeding or any serious wounds, but second would be that concussion. So make sure that you get in as soon as possible. So the challenges that we're trying to figure out right now, Mint is trying to figure out better communication, better organization in our information. It's super important if you've been in a car crash or you got hurt at work or really with any injury, but especially with those ones, that you have the right communication. We're getting a whole new software, completely changing our system over so that we have a better software that organizes everything so nothing falls through the cracks. I'm really excited about that, and it will create better communication for any of the doctors involved in the same cases with us, and our patients are really going to enjoy this because that's one of the most annoying things. If you go to your doctor and you have to remind them of tests you've had done or bring those tests with you, if we can have one system that brings it all together, it's going to be a lot more efficient. So I want to tell you guys really quick about Taiwan. Taiwan actually has one of the best systems in the world for this aspect. If you study healthcare systems around the world, there's a lot of pros and cons to different ones. Anything from socialized programs to private programs, there's pros and cons. And some of the cons with like a socialized program might be waiting time or lack of freedom to get the care that you want. And then there's the benefits of like Taiwan system where they actually have a medical card. And if you take that card anywhere, swipe it or scan it, however it works, at any medical doctor, it takes your entire medical history with you. So you don't have to remember which day the surgery was on or what the details were, what did my MRI say, what medication was I taking at that time or what medications am I taking now. It's all on one card, which makes it super convenient. You change doctors, all the information's there because anytime the doctor charts anything, it gets added to that system. Now, I haven't been to Taiwan, that's just what they taught us in grad school, but it sounds like a fantastic system. Better communication and better tracking of all of that data. If someone walked into Mint today versus a year ago, what would feel different? All right, last question. So what would feel different is people know the plan more. You're gonna be with the same physical therapist more often now. In the past, because we were on the go, we were in and out of clinics, we were at people's homes. Ryan might be here at one point and I'm at somebody's house, and then we switch as he goes to somebody else's house and I come to the clinic. So you're ending up seeing whoever's available, right, to meet your schedule. And that can still happen a little bit because if you need a specific time, 7 a.m., then let's look for who's available at 7 a.m. to see you. But if you want a specific therapist, then you might need to be a little flexible with your schedule. You're like, I really want to work with Christian, then when is Christian available? And here's the different options. But you can have the same physical therapist every single time. When you come in, we've got better communication, better chart prep, everything. When you start physical therapy with Mint, there's a plan on every aspect of what we're doing. So we've reached a point where we're a lot more organized on that. Mint is also creating more opportunities where we've got telehealth in addition to treating you at your home or in our office. If you're sick and so you can't make it in, we can still work with you and help you keep moving forward. Those are some of the biggest changes. We've got a couple new team members as we continue to grow. And obviously the new space. So you got to come check it out. Come check out our Murray Clinic. It's fantastic. And you're going to really enjoy the ambiance, the setup, the sporting setup of it. We've got a squat rack. We've got turf. It's going to be awesome. You're really going to enjoy it. All right, thank you guys for listening to this episode. We're really excited to share more about our journey along the way as we help you on your journey to living a mint condition life. Make sure that you follow or subscribe wherever you're getting this content. Follow us so that you can keep hearing more about what we're doing differently and maybe learn along the way with us. Please share comments down below, whatever platform you're on. Share comments on what you want to see. What do you want to learn more about? We're going to be doing interviews with pain doctors, with other physical therapists, chiropractors. What do you want to learn about? Are you worried about your MRI and what it says? Are you worried about recovery times with your surgery or different injuries that you have? And do you want to learn how to know which provider is the right one for you? Come back and we'll have all that content on future episodes.